Good evening, friends. Today's discussion would be on biochemistry, and we will cover most of the important topics of biochemistry in 3 sessions. So, first session, yes, we start without any delay. Okay, so I start with conceptual thing. No need to mug up. Many questions will be solved by this flow chart. I will share this flow chart with you. As previously requested by many students that it should be in chanting should be in English. So keeping in the mind, I will be most of the things would be in English. Okay. So as we take diet, you all know as we take diet is made up of carbohydrate, lipid and protein. You all know. Carbohydrate, the representative of carbohydrate or the prototype of carbohydrate is glucose. So carbohydrate means glucose. Immediately this comes in our mind, and you all know each and every cell utilize glucose for the production of energy by glycolysis. So you all know glucose is having 6 carbon atom. Yes, 6 carbon. Just listen it carefully and I will tell you how many questions will be solved by this flow chart only, and each and every point would be conceptual. So, Manoj, very good evening. Okay, glucose is having 6 carbon atom. First question, what is glycolysis? Conversion of glucose 6 carbon atom to 3 carbon atom pyruvate. So, 2 molecules of pyruvate. A question is asked that in glycolysis, how many ATPs, net gain of ATP in aerobic glycolysis? I write here, yes, not here to so that we can avoid congestion. Aerobic glycolysis net gain 7 ATP, while anaerobic glycolysis, yes, net gain 2 ATPs. So mug it up, 7 ATP, 2 ATP. Now, conversion of 6 carbon to 3 carbon, this is glycolysis pyruvate. This pyruvate enter the mitochondria. Yes, you will remember that anything which is occurring outside this box, that is cytosol, and which is occurring inside it, that is mitochondria. So pyruvate enter mitochondria with the help of H ion symport. This is question. पायरुवेट पार कर जाता है किसकी हेल्प से? एच आयन की हेल्प से पायरुवेट पार कर जाता है इनर माइटोकॉन्ड्रियल मेम्ब्रेन. Now pyruvate enter the mitochondria having 3 carbon atom is converted to 2 carbon atoms acetyl coenzyme A. That conversion 1 carbon is removed and removal of carbon dioxide is called decarboxylation, and in this the name of enzyme is pyruvate dehydrogenase. Dehydrogenase means removal of hydrogen, and in this NAD is converted to NADH. So NAD is converted to NADH. So removal of hydrogen is called oxidation, joining of hydrogen, reduction, removal of hydrogen, oxidation, and removal of carbon dioxide, decarboxylation. So this reaction is example of oxidative decarboxylation, and the cofactor is vitamin B1, that is thiamine. Okay, even if you don't remember, okay, I remove this because I want to be more and more conceptual, so that you can solve question by the concepts. So acetyl coenzyme A enter the Krebs cycle, and in Krebs cycle 1 acetyl coenzyme A produce 10 ATPs. How many ATPs? 10 ATPs. How these are produced I am leaving because it's a fast revision. If you remember these number of ATP, that would be sufficient to solve many questions, and my focus is on more and more concepts. Yes. So this Krebs cycle, I highlight this Krebs cycle. This is occurring in mitochondria. Yes or no? Yes. So this question is asked, Krebs cycle occur in which organelle? That is mitochondria. Now This reaction pyruvate to acetyl coenzyme A, this reaction also occur in mitochondria. This also occur in mitochondria. So glycolysis is occurring in cytosol. No need to mug up that which pathway occur in cytosol, which is occurring in mitochondria, which is activated by insulin, which is inhibited by insulin. Just remember this flow chart and you will understand. Yes, you all know whenever we take diet goes to intestine glucose is absorbed, this reach blood. When blood glucose is high, that is diabetes. If blood glucose is low, that is hypoglycemia. So we maintain our blood glucose. You all know that liver is the main organ of metabolism. What I said? Liver is the main organ of metabolism. It is the responsibility of liver to maintain blood glucose. So when you took diet, glucose in diet, carbohydrate in diet, absorbed in blood. In blood, yes, when glucose increases, this glucose goes to pancreas. And in response to glucose, pancreas release insulin. This is frequently asked question of physiology, that what is the stimulus, very important stimulus for insulin secretion is glucose. So glucose, you took diet, blood glucose increased reached to pancreas, released insulin. Now what is the function of insulin? I write here what is the function of insulin. Insulin, I write in a mnemonic form. Main, M-A-I-N. Main, I write like this. Main function of insulin is to decrease blood sugar. To decrease blood sugar. Yes, you all know if your insulin is not there, then blood glucose increases, that is diabetes. So insulin wants that blood glucose should be decreased at any cost. Now, no need to mug up. I ask you, if glycolysis is activated, more and more glucose will be utilized by cells. So blood glucose will be decreased or increased. I want your yes. Yes, thank you, Himal. Yes. So please do reply. Yes, blood glucose will decrease or increase. I want your answer. Yes, if I increases glycolysis, cell will take more and more glucose from blood and will divert towards pyruvate synthesis. So blood glucose will decrease or increase? Decrease. Good, Hemal. Yes. So yes, these will be kept on YouTube. Okay. So it is decreased. It is decreased means insulin will activate glycolysis or inhibit glycolysis. Insulin wants to decrease blood glucose, and any reaction which decrease blood glucose will be activated by insulin. Any reaction which decrease blood glucose is activated by insulin. So if I ask you that glycolysis, yes, MBBS Khan, very good, yes, decrease. So glycolysis will be activated by insulin or inactivated by insulin? This is activated by insulin. Clear? Now if pyruvate is converted to acetyl, definitely I will do. Yes, if pyruvate is converted to acetyl coenzyme A, yes, then this means in this way, in this flow, if you increase the flow like this, so this pyruvate dehydrogenase is activated by insulin or inactivated by insulin? Yes, this is activated by insulin. So no need to mug up, just remember. We want that extra glucose should be converted to glycogen. Means liver is the organ which try to maintain blood glucose. Whenever we take diet, blood glucose increases. Liver take this extra glucose and convert into glycogen. So this is glycogen synthesis. Glycogen synthesis, the rate limiting enzyme is glycogen synthase. If I ask you, more and more blood glucose is being converted to glycogen, so blood glucose will decrease. So insulin will activate glycogen synthase or inhibit? Please do reply. Insulin will activate glycogen synthase or inhibit glycogen synthase? Yes, insulin activate glycogen synthase. Yes. Now, so what is the function of carbohydrate? We found that carbohydrate is present in large amount in our diet. So one function of carbohydrate is energy production, which is done by glycolysis and this pyruvate dehydrogenase, and both are activated by insulin. Second function is that this extra glucose is converted into glycogen and is stored in liver. The third function is to produce reducing equivalent, that is NADPH. What I said? Reducing equivalent. You all know that our cells are exposed to oxidative stress. If I randomly ask you, the main constituent of our diet is carbohydrate. If you take a normal diet, you will find that 60-70% of our diet is carbohydrate. 15 to 20% is about 15-20% is lipid. 15 to 20% means majority of our diet is carbohydrate. So carbohydrate is having multiple function in our body. Yes, I will solve so many questions by this concept. Yes, very good, Hemal. Yes, so for the time being, yes, this carbohydrate HMP shunt, one function of carbohydrate is HMP shunt, that is production of NADPH. HMP shunt produce NADPH. Now, no energy production, no ATP production, because if you want to produce ATP, you will do glycolysis. If you want to reducing equivalent, then HMP shunt. Clear? So you can easily remember. Now if I divert this glucose in multiple direction, glycogen activated by insulin, blood glucose will decrease. In this direction, activated by insulin, blood glucose decreases. In this direction, yes, activated by insulin, this is also activated by insulin. So all these pathways are activated, their enzymes are activated by insulin. Now what about Krebs cycle? Krebs cycle produce 10 ATP. It is a main pathway produce energy. It is not regulated by hormone. It is regulated by the energy requirement of cell. If energy in the cell is less, Krebs cycle will be more. If energy is sufficient, Krebs cycle will be less. So this Krebs cycle has no hormonal regulation. No hormonal regulation. Yes? Good, Himal. Yes. Now, this, when energy requirement of cell is fulfilled, even if the glucose is more and more, now these acetyl coenzyme will be thrown outside. Why they are thrown outside? Because these acetyl coenzyme will be converted into fat. These converted into fat. Fat means fatty acid. Now let me tell you, what is the concept? You know, previously there are so many disasters, just like even now, Ukraine war. Yes, no food available, and if a person is not getting food for a long time, then fat is used for the production of energy. That adipose tissue we do have. Yes, in this, yes, we do have adipose tissue, and in adverse condition we can utilize fatty acid for the production of energy. We can also use protein for the production of energy. So nature decided that whatever extra carbohydrate we will take, that extra carbohydrate will be converted into fat, So fat in our body is synthesized from carbohydrate. So carbohydrate is converted to fat. Yes or no? Yes, carbohydrate in our body is converted to fat. From this concept, there is a question asked in AIMS, Atkins diet. Let me tell you the story. Yes, the real story. Previously, you must have seen the old movies. Hero used to be chubby. Yeah, गोल मोल, जितने गोल उतना हीरो. यस, तुम देखोगे पुरानी मूवीज़ के हीरो जितने भी गोल हुआ करते थे तब हीरो कहते थे. क्यों? प्रीवियसली देयर वाज नो कोल्ड स्टोरेज. इफ ए पर्सन इज नॉट गेटिंग फूड देन ही कैन सर्वाइव ओनली बाय द फैट. वही मम्मी का प्यार है ना, जो MBBS डेज में लड्डू, देसी घी के लड्डू we used to get from mother and we used to hide with friends. वही प्यार आज हमारे पास फैट के रूप में है. In adverse condition, yes, this fat can be utilized for the production of energy. So previously there was a concept that if we want to decrease weight, decrease fat in your diet. हमने फैट कम कर दिया, बट कार्बोहाइड्रेट, वी आर टेकिंग कार्बोहाइड्रेट, बट यू नो एक्स्ट्रा कार्बोहाइड्रेट. Yes, Rishi Kapoor. Yes, extra carbohydrate is converted to fat. So we say if you want to decrease weight, decrease carbohydrate in your diet. So Atkins diet is low calorie. Total calorie must be low, plus low carbohydrate diet. Low carbohydrate diet, low calorie plus low carb diet, that is Atkins diet. Now this fatty acid, yes, is converted to triacylglycerol, and this means fat in our body. Fat has two sources. Let me simplify first. If I ask you, if I divert this glucose in the conversion of fat, the blood glucose will decrease or increase? Decrease. So fatty acid synthesis is activated by insulin. Here the enzyme is acetyl coenzyme carboxylase. Question is asked that fatty acid synthesis rate limiting enzyme acetyl coenzyme carboxylase is activated by insulin or inhibited by insulin? Sorry, this is activated by insulin. No need to mug up. As we took diet, blood glucose increased blood glucose goes to goes to pancreas, release insulin wants that blood glucose should decrease, and any pathway will decrease the blood glucose will be activated by insulin. This glucose is diverted towards glycogen, activated by insulin. Glucose is diverted towards glycolysis, activated by insulin. Pyruvate is coming to acetyl coenzyme, activated by insulin. This is energy. This is hormone independent. Extra acetyl coenzyme converted to fatty acid synthesis, activated by insulin. So starting point of fatty acid synthesis is acetyl coenzyme. So now you can say one function of acetyl coenzyme is energy production by Krebs cycle. One function of acetyl coenzyme is to produce fatty acid, and the third function of acetyl coenzyme is cholesterol. Yes, you must have an idea. Two acetyl coenzyme join to form cholesterol. Now, I have already told you, whatever is occurring outside this, chamber, that is occurring in cytosol. So if I ask you, please do reply, fatty acid synthesis occur in mitochondria or cytosol? Fatty acid synthesis occur in mitochondria or cytosol? Please do reply. Cholesterol synthesis occur in mitochondria or cytosol? HMP shunt occur in mitochondria or cytosol? Glycogen synthase occur in mitochondria or cytosol? Glycolysis occur in mitochondria or cytosol? All these pathways are occurring in cytosol. Yes, all these pathways outside this chamber is occurring in cytosol. If you remember this flow chart, no need to mug up. This will help you to solve multiple questions. Starting point of cholesterol is acetyl coenzyme. Starting point of fatty acid synthesis is acetyl coenzyme. All these occurring in fad state. All these are occurring in fad state. What is fad state? We are taking our diet regularly at a regular time interval. So you questions are asked, cholesterol synthase occur in fad state. Oh, yes, after taking food. Okay, got the point? So you will remember. So I just told you that fat can be synthesized in our body. Yes or no? Yes. I just told you that carbohydrate can be converted to fat. Fat can come from diet. If fat come from diet, fat is also called triglyceride, triacyl glycerol or neutral fat, which comes from diet. The fat which comes from diet, that is coming from outside, exogenous, and the fat which is synthesized in our body, that is called endogenous. Means in our body fat has two sources. First source is coming from diet, which come from diet, that is called exogenous, which is synthesized in our body, that is endogenous. And you know, most important organ of metabolism is liver. So fatty acid synthesis occur in liver, lipid synthesis occur in liver. So this endogenous triglyceride is synthesized in liver, and this is transported in the form of VLDL. Endogenous VLDL. Exogenous triglyceride is transported in the form of, yes, very good Shivangi, yes, they are skilled. Okay, so exogenous triglyceride is transported in the form of chylomicron. Now a question was asked, a person, please do reply, I am not writing the question, you should hear question carefully. Yes, make habit to process your mind in such a way, to train your mind in such a way, when you are hearing immediately you start calculating, you start analyzing. Okay, so let me describe. A person on fat free means he is not taking fat, carbohydrate rich diet, he is having large amount of carbohydrate. And you know, if taking large amount of carbohydrate, all that extra carbohydrate is converted to fat. If more and more fat is being produced, person is obese. So a person on fat free carbohydrate rich diet continues to grow obese. Which lipoprotein would be present in his sample? Yes, please do reply. Which lipoprotein? Which lipoprotein? That is, yes, which lipoprotein? Chylomicron. Very good. Chylomicron. Because more and more. So till now I have discussed few points. Yes, I have left the catabolic pathway, catabolic portion. I will discuss, don't worry. For the time being, all these pathways are activated by insulin. Okay, sorry, Hemal, not chylomicron. Sorry, I was so influenced by your answers. Yes, more and more. Let me explain again. A person on fat free carbohydrate rich diet continues to grow obese. Which lipoprotein is increased? That is, more and more VLDL will increase. Opposite, a person on fat rich diet continues to grow obese. Which lipoprotein will be increased in this patient? Yes, sorry Hemal, that is, okay. No, don't. Yes, uh, sorry for that. That is, if I ask you, a person on fat rich, that was my slip of tongue. So, what is the significance of slip of tongue? I will tell you later. For the time being, yes, yes. Uh, if a person on fat-free carbohydrate-rich diet means VLDL increase, a person on fat-rich diet, no chylomicron should not be increased because we take sample after 12 hours of fasting. When you see lipid profile, after 12 hours of fasting, chylomicrons are cleared. But even if they ask question, then you will prefer to mark chylomicron. In that case, if fat-rich diet, if fat-free diet, yes, carbohydrate diet, they will say VLDL. Clear? Not HDL, that is VLDL. Okay. Now, I ask you, yes, let me discuss glycogen storage disease. Yes, glycogen storage disease, I will discuss here. Glycogen. In liver, glycogen is stored in liver, and in glycogen storage disease, two types of glycogen storage disease may be there. One glycogen storage disease is muscle glycogen storage disease. Let me write like this, draw like this, muscle glycogen. I will give you the handouts of these, yes, on the Telegram group. Yes, and this is liver. Okay, so we found that this muscle has glycogen. This muscle has glycogen. It is hanged. Let me. Muscle has there is some technical glitch. Pen. Okay. Muscle says myself. Meanwhile, they are arranging for the pen. I think some technical issue with pen. Okay. Thank you. Yes, this is now working. So muscle says myself means muscle use glycogen for itself. Yes, initially in this session I am taking more and more conceptual thing. Next session I will be more and more question based. Don't worry. So muscle says myself means muscle glycogen is used by muscle only, but liver glycogen maintain blood glucose. Glycogen maintain blood glucose. Yes. Yes, means liver is the main organ of metabolism. When we take food, blood glucose increases. Liver take this extra glucose and convert into glycogen. In between meals, blood glucose is being utilized by each and every cell. This is occurring. We took lunch. After lunch, blood glucose increased. Blood glucose increased. Liver took that extra glucose and converted into glycogen. In between meals means lunch to dinner. Yes, suppose we have not taken dinner till now, I have not taken, so means blood glucose is being utilized by each and every cell in our body, so blood glucose will tend to decrease. But you know, decreased glucose is hypoglycemia, so liver will break down this glycogen to maintain blood glucose. Liver is the main organ of metabolism, so in between meals blood glucose is maintained by, in between meals, blood glucose is maintained by liver glycogen. And liver is having glycogen which can last up to 16 to 18 hours. Means if I continue the class, yes, if we are suppose we are very happy and you start saying, sir, continue the class, the whole night we will read, and we have taken lunch only, nothing else have taken, we will not develop hypoglycemia till morning. Why? Because our liver is sufficient to maintain blood glucose up to how many hours? 16 to 18 hours. 16 to 18 hours. Recently asked question, this was the question. A person who had dinner at 8 p.m. gave his blood sample for glucose at 7 a.m. next day. Okay, means 12-hour fasting, 12 11-hour fasting. What is the source of energy of body during this period, or the source of yes glucose in this period? Then please do reply. What should be the answer? Yes, I am waiting for your answer. Yes, you all know that. Yes, hepatic. Very good, Hemal. Hepatic glycogenolysis, because our liver glycogen is sufficient to maintain blood glucose up to 16 to 18 hours. So this is very good, Ramya. 16 to 18 hours. Recently asked question. Okay, I have done it. Okay, now so glycogen is normally converted to glucose and maintain blood glucose. So there are glycogen storage disease may be classified on the basis of liver glycogen storage disease and muscle glycogen storage disease. Liver glycogen storage disease, if liver glycogen is disturbed or not metabolized, then liver glycogen will not be able to maintain blood glucose. Yes, so there would be fasting hypoglycemia. Yes or not? Yes. So in glycogen storage disease, liver glycogen storage disease, they are fasting hypoglycemia. When this glycogen will not be broken down, this will accumulate in liver, so there would be hepatomegaly. So wherever you find hepatomegaly and fasting hypoglycemia, you will think of liver glycogen storage disease. Clear? Now, this glycogen which is accumulated in liver, that may be normal glycogen or that may be abnormal glycogen. So many times questions are asked and you solve question on glycogen storage disease only by one point. They say that abnormal glycogen accumulated in liver. If abnormal glycogen accumulated in liver means two disease may be possibility. One is Anderson disease, given in your handout. I will distribute, don't worry, just listen carefully. Anderson disease and Cory's disease. Okay, Anderson disease and Cory's disease. Mnemonic is A B C D. Mnemonic is A B C D. A B for abnormal. In Anderson disease, that is type 4, branching enzyme deficient. Cory's disease, debranching enzyme is deficient. So you can easily remember very easily abnormal glycogen. Mnemonic is abnormal, means A B C D. A for Anderson disease, branching enzyme deficient. Cory's disease, debranching enzyme is deficient. Anderson is type 4 and Cory's is type 3. So Cory's is type 3. Okay, clear? Now sometimes you will solve the question only by the name itself. Mnemonic for this, yes, Cory's disease, I usually say that if you read the name carefully, you will find the answer. If you read the name carefully, Cory's disease cures itself. Cures, Cory's disease cures itself. Yes, reads hello, cures itself. And does, yes, let me tell you question. Yes, cure itself means many time you will find that patient cures itself when reach adulthood. Means initially hepatomegaly is there, fasting hypoglycemia is there, growth retardation is there. Yes, when this patient reach adolescence, at that time he recovers. Many times in Cory's disease. Cory's cures itself. Now please tell me the answer. A 6-month-old child presented with fasting hypoglycemia. Fasting hypoglycemia, I told you, liver glycogen storage disease, fasting hypoglycemia may be there. Hepatomegaly may be there. Other symptoms, yes, growth retardation. Once this child reach puberty, no longer has hypoglycemia, muscle weakness, hepatomegaly, he reached normal adult height also. What is the most probable diagnosis? Yes, please do reply. Very good. So how you solve the question? You solve the question only by one word, that Cory's cures itself. Name itself tells you. Not only in this, yes, I will do chanting of patho, pharma and micro. At that time you will realize that each and every word says something. But you should hear that. This is my specialty. Yes, I am a psychiatrist and I have worked a lot on memory techniques. And I know that how each and every word is speaking something, but in a different language, just like Harry Potter, partial tongue. Yes, you must have seen Harry Potter movie. Yes, that is partial tongue. Okay, Sarp Bhasha. And if you learn that Bhasha, you will solve many questions. Anderson, and of sun. Anderson, and of sun means beta mar jayega. And of sun. Yes, death by 4 years. As usually you will find the word 5 years many in standard textbook, but I have deliberately taken 4 so that you will remember it is type 4. So abnormal, either life, either death. Either life cures itself, Anderson, end of sun. Glycogen is, if glycogen is normal, then it may be von Gierke's disease. Von itself tells you type 1. In type 1, which enzyme is deficient? In type 1, which enzyme is deficient? That is glucose 6 phosphatase. Glucose 6 phosphatase is enzyme for both glycogenolysis and gluconeogenesis. Yes, this enzyme glucose 6 phosphatase is the last enzyme in liver glycogenolysis and gluconeogenesis. So in liver neither glycogenolysis occur nor gluconeogenesis occur. And you all know gluconeogenesis also occur in kidney. Yes, you all know, question is asked, gluconeogenesis. Yes, glucose, yes, in kidney, yes, and liver gluconeogenesis occur, and the last step is catalyzed by glucose 6 phosphatase. So in von Gierke's disease, what will happen? In von Gierke's disease, kidney will try to maintain blood glucose and kidney would not be able, because gluconeogenesis last step is deficient. So there would be renomegaly. This is the catching point. What I said, this is the catching point. In any glycogen storage disease, if you find the word renomegaly, without second thought, answer would be von Gierke's disease. Now solve the question. Sometimes we think that long clinical question is very disturbing and yes, they are very difficult, but I say these are the simplest question. A 2-year-old boy presented with fasting hypoglycemia. I think it's not so clear, but I will share this with a little bit better way. So let me try after the class. I will try to send. Yes, rates definitely doll-like faces is a point. Yes, doll-like faces is not specific. Point it out. you can't make the diagnosis of glycogen storage disease type 1 only by doll-like faces. Yes, this is not, it's subjective that if a face is doll-like or not. Other than that, so many disorders you will find that similar appearance would be there. But the catching point is enlarged kidney. Enlarged kidney. Yes, Shivangi, very good. Yes, von Kirkes disease. Von Kirkes disease, no splenomegaly, hepatomegaly. Definitely, this doll-like faces is quite common, and sometimes you will find that in von Gryke's disease there is severe hypoglycemia, but you can't make diagnosis of von Gryke's disease by the word severe hypoglycemia. You must be little bit more specific. These are called keywords, catching points. Okay, when we will discuss in medicine path, that these key points are quite specific to solve long clinical questions. Okay. So von Gryke's disease. In von Gryke's disease, there is also gouty symptom. G4, G4, G4 gout, G4 gout. In House disease, there is deficiency of type 6 liver phosphorylase. Liver phosphorylase. Yes, phosphorylase deficiency. And in this, no gout, no gout, no rhinomegaly, no rhinomegaly, no lactic acidosis. But in this von Gryke's, lactic acidosis would be there. Lactic acidosis would be there. Clear? So this is very easy to differentiate for. So again I repeat, simply you will see normal or abnormal. Abnormal ABCD, normal it may be von Gryke's or 6. Now muscle glycogen storage disease. If muscle glycogen storage disease and you find hypertrophic cardiomyopathy, without second thought you will mark Pompe's disease. Pompe's disease, type 2 glycogen storage disease. How to remember? Heart pumps the blood. Heart pumps the blood. What I said? Cardio means heart. Heart pumps the blood. So if any question is asked and they have not given hypertrophic cardiomyopathy, you can't mark Pompe's disease. Many times you will find the picture MCQ and they will give you X-ray in which the cardiac shadow would be like this, very large. Means that is hypertrophic cardiomyopathy. Answer is Pompe's disease. Heart pumps the blood. Okay, and you can easily remember, question is asked, in Pompe's disease death occurred due to heart failure, pump failure. Okay, you can remember like this. Very good. Now you look, in type 2 there is floppy infant is there, but you can't say floppy infant is there, you immediately mark type 2 glycogen Pompe's disease. I told you the catching point. Yes, in this question, a 2-month-old infant presented with generalized muscle weakness. How much duration? 2 months. In fact, a question is also asked that Pompe's disease manifests early in infancy. How to remember? Name itself tells you. Pompe's prompt. Pompe's promptly means symptoms occur prompt, means early. Okay, so floppy infant appearance, he also has the feature like macroglacia, feeding difficulty, hepatomegaly. Catching point is hypertrophic cardiomyopathy, type 2 glycogen storage disease, Pompe's disease. Clear? Yes, very good. Type 5 McArdle disease. McArdle disease. McArdle disease. McArdle disease. Okay, what is McArdle disease? Yes, in this muscle phosphorylase is deficient. Muscle phosphorylase deficiency. Muscle phosphorylase is deficient. Okay, in this what would be there would be exercise intolerance. When you do exercise, even then after that there would be rhabdomyolysis. This will be myoglobin will be excreted in urine, that will lead to burgundy color of urine. So these are the symptoms of McArdle disease. Got the point? So this is about glycogen storage disease in short. Yes, one more question. Yes, very good. It's yes, this question recently asked, picture MCQ, very easy. Whenever you find they ask about heteropolysaccharide, if they ask about heteropolysaccharide, in heteropolysaccharide structure is given, first catching point is hyaluronic acid. No, yes, in all mucopolysaccharides you will find sulfate. What I said? In all mucopolysaccharide you will find sulfate. Yes, if I ask you heparin, sulfate is there. Chondroitin sulfate, sulfate is there. Keratin sulfate, sulfate is there. But if I ask you hyaluronic acid, is there any sulfate? Yes, please do reply. Is there any sulfate? This question has been asked in 20 years 4-5 times. That know which of the following mucopolysaccharide don't have sulfate, and this is single liner question and answer used to be hyaluronic acid. But this time AIMS asked the question, picture MCQ, they gave this structure and they ask which of the following is this. Yes, and you can easily see no sulfate, no sulfate, no sulfate. So answer is yes, answer is C, hyaluronic acid. Okay, now second point is no acid, uronic acid. What I said, no uronic acid in keratin sulfate. No uronic acid in keratin sulfate. Keratin sulfate. Kirtan. Yes, in Hindi. Yes, sorry for those who don't know Hindi, but as I promised you that I will try to keep most of the things in English, because 2-3 comments, even a single comment do matter for me. Okay, so definitely, so I am here only to help you, and in this session definitely remain connected with me, and I will go through all the subjects in a simpler way, in conceptual way and mnemonic way. Okay, so little bit Hindi is allowed. कीर्तन you all know that माता का जागरण होता है, कीर्तन होते हैं, वहाँ पेशाब नहीं करते, यूरिनल नहीं बनाते, they don't make urinal near माता जागरण कीर्तन. So I make mnemonic like this. So कीर्तन, keratin, no uronic acid, no uronic acid or no acid. If I ask you, acid is there, acid is there, acid is there in this structure, is there any acid? Please do reply yes or no. Is there any acid? Keratin sulfate, no acid. Yes, keratin sulfate, no acid. So this is keratin sulfate, no acid, that's why it is keratin sulfate. So next question may be, they will give you a simple conceptual thing. You must know, you can identify the structure by looking only one point. First thing, you will search for the sulfate. If sulfate is not there, the answer is hyaluronic acid. Second point, you will search for the acid. If acid is not there, then it is keratin sulfate. And kerato word is used for cornea, keratoplasty. You must have heard in ophthalmology. So keratoplasty, cornea. So in cornea, if cornea means, keratin sulfate is present in cornea. Question was asked, the transparency. Yes, Khan. Okay, don't urinate. Good. Yes, your response keep me activated. Okay. So yes, this question was asked. Yes, corneal transparency is decided by keratin sulfate. In fact, there are collagen and keratin sulfate in appropriate amount which maintain the transparency of cornea. Okay, yes. So we have discussed this question, I think. Yes, galactosemia we will discuss later, but yes, this is a question. Citric acid cycle, Krebs cycle, citric acid cycle, Krebs cycle. Okay, in this I will. This acetyl coenzyme is having 2 carbon. Yes, this is very important. Oxaloacetate is having 4 carbon. Citrate is having 6 carbon. This 6 carbon is converted to 6 carbon by that same enzyme 2 steps aconitase. Yes, citrate or isocitrate, name itself tells you isocitrate is isomer of citrate. So if citrate is having 6 carbon, so isocitrate is also having how many carbon? 6 carbon. Is converted to alpha ketoglutarate. This is having 5 carbon. If a 6 carbon compound is converted to 5 carbon compound, then 1 carbon is removed. Removal of carbon dioxide is called decarboxylation, and the name of enzyme is isocitrate dehydrogenase. Dehydrogenase means removal of hydrogen, and hydrogen is taken up by NAD to form NADH. NAD to form NADH. Dehydrogenase means removal of hydrogen is called oxidation. So this reaction is example of oxidative decarboxylation. Oxidative decarboxylation. And a cofactor for oxidative decarboxylation is, anybody, please do reply. The cofactor for oxidative decarboxylation is vitamin B1. Yes, for the time being I write. Alpha ketoglutarate 5 carbon is converted to succinyl coenzyme 4 carbon. You can easily remember succinate, you looks like 4. Succinate, yes, Hemal, very good. 4 carbon. When 5 carbon is converted to 4 carbon, 1 carbon is removed. Removal of carbon is called decarboxylation, and the name of enzyme is alpha ketoglutarate dehydrogenase. Removal of hydrogen is called oxidation. So another reaction is example of oxidative decarboxylation, and the cofactor is vitamin B1. So yes, if B1 is deficient, I say question, B1 is deficient, lead to beriberi. Which enzyme is responsible? Which enzyme is inhibited? This one or this one? Yes. Please do reply. Yes, this question has been asked. Beriberi, B1 is deficient, which enzyme is inhibited? Yes, alpha ketoglutarate. Yes, one. Meanwhile, I am getting your answer. Yes, I am explaining a very frequently asked question. CO2 is removed just before and after alpha ketoglutarate. Yes, but I am giving only 2 options and 1 to choose. This one or this one. 1 to choose. Very good, Umesh. Yes, you have read till now the partial thing. Yes, oxidative decarboxylation of alpha keto acid. B1 is cofactor. Yes, very good. No, dear. B1 is cofactor for oxidative decarboxylation of alpha keto acid. Isocitrate is not alpha keto acid, so B1 is not a cofactor for this enzyme. So B1 is not cofactor for this enzyme. In this, B3 is cofactor. Clear? Got the point? So this question is asked and you mark out in Krebs cycle this. Yes, pyruvate dehydrogenase, definitely that is a link reaction. Pyruvate dehydrogenase, this pyruvate dehydrogenase is also enzyme of pyruvate dehydrogenase is also oxidative. Yes, oxidative decarboxylation, and pyruvate is keto acid, alpha keto acid, so B1 is cofactor. Branch chain alpha keto acid dehydrogenase. What I said? Three enzymes. Pyruvate dehydrogenase, pyruvate is alpha keto acid. Branch chain alpha keto acid, name itself include alpha keto acid dehydrogenase, pyruvate dehydrogenase, and sorry, alpha ketoglutarate dehydrogenase. And you know that how ammonia is toxic. This ammonia, when increases, this ammonia bind to alpha ketoglutarate. What I said, ammonia is very toxic. Why ammonia is toxic? Extra ammonia bind to alpha ketoglutarate to form glutamate, then glutamine. This question was asked that in hyperammonemia, Krebs cycle stops. Why? Because of depletion of which compound? Which compound? Yes, this is the question. Hyperammonemia, please do reply. Yes, hyperammonemia inhibit TCA cycle by depleting alpha ketoglutarate. Clear? Alpha ketoglutarate. So few of you must have attended my lecture. Yes, if not, then in tomorrow's class, means next, sorry, not tomorrow, next class we will go in the journey of this question. Yes, how the same question, different answer, same question. Yes, anybody have idea about different? Okay, we can do 5-10 minutes, it will require only. Yes, this is, yes, I never thought that I will make this kind of mnemonic. I am not this kind of person, but sometimes yes, coincidence, yes, a person presented with diarrhea. Yes, these thoughts are not my own thoughts. Yes, I started making mnemonic and then I realized that it can be connected in this way. But I never thought that I will make this type of mnemonic. Sorry, yes, castle neck, yes, very good. So, diarrhea, dermatitis, dementia, dermatitis, typical castle neck appearance. What is the answer? Yes, what is the answer? Yes, in this answer is B3. But in the same question, answer may differ. Let me tell you. Tryptophan, 60 milligram, I will be little bit faster. Yes, 60 milligram of tryptophan give rise to 1 milligram of niacin. Yes, tryptophan, a question is asked. Tryptophan is an amino acid which is having this large bulky side chain, and the name of this side chain is indole ring. I say indole, baby doll. Indole is baby doll. Yes, and so many fans are there. Baby doll, you all are fan? Yes or no? Yes, so many fan, and all fan are trapt. In Hindi, you know the meaning of trapt. Okay? Yes, tryptophan, 60 milligram tryptophan give rise to 1 milligram of niacin by this pathway. In this 3-hydroxyquinuranin is converted to 3-hydroxyanthranilate. Yes, and in this the enzyme is quinuraninase. Yes, anthranilate, if you know, long time back there was a famous actress Antara Mali. I have given the photo also. Nia Sharma, Antara Mali, baby doll. Yes, yes, I will discuss all the points, don't worry. Okay, are having similar features more or less. We found that normally 60 milligram of tryptophan give rise to 1 milligram of niacin, and in this reaction this enzyme quinuraninase cofactor is B6. If B6 is deficient, this enzyme is deficient, then niacin will not be produced and resulting in pellagra. Yes, I don't want to dissociate but this word, but if you dissociate it is little bit vulgar. Okay, yes, yes, niacin pellagra, okay, deficiency. And in this B6 deficiency quinuraninase will not be active, so quinuranin will be converted to xanthuronic acid, so increase xanthuronic acid. So if B3 is deficient, then this is the picture. In the same question, yes, you will be surprised the same question is being asked 5-6 times. What is the reason? They are changing only one word, means they change this word, that in this there is deficient, there they added only one word, increase xanthuronic acid. Now what is the answer? Yes, what should be the best answer? A person with this plus this. If only and only this, you mark answer B3 as the best answer. But other DD, yes, if this is increased, then what would be the best answer? Then B6 deficiency. Why B6 deficiency? Because increase xanthuronic acid. Increase xanthuronic acid. Clear? Good. Not Hartnup. Hartnup I am telling you. What is Hartnup? Hartnup is autosomal recessive disease. Hartnup is autosomal recessive disease. In this tryptophan and neutral amino acid are not absorbed in intestine and renal tubule. So if they say in the same question, they say defective absorption. In the same question, they say defective absorption of tryptophan, then you will mark answer Hartnup. You will mark answer Hartnup. Clear? Now, you all know that tryptophan in our body is converted to serotonin. Frequently asked question, serotonin. Yes, serotonin precursor is tryptophan. Serotonin is further converted to melatonin, and serotonin is metabolized to HIAA, hydroxyindole acetic acid. HIAA. Normally tryptophan is converted, but in carcinoid syndrome, more and more tryptophan is converted to serotonin, more and more serotonin is converted to HIAA. More so, in the same question, if I say increase HIAA, what would be the answer? Carcinoid syndrome. Clear? Means if more and more tryptophan will be converted to serotonin, no extra tryptophan to form niacin, pellagra like symptom. Okay, now what a coincidence. I never thought Yes, when you will see these types of thing, baby doll, Nia Sharma, Antara Mali, your heart would up. Yes, and this is carcinoid, car scene of PK, dancing car, HIA, ye Haya, Sharm or Haya. Yes, I never thought that I will make this kind of mnemonic. Again, I am telling you. Okay. Antara Nilate, Antara Mali, Nia Sharma is on the line of these celebrities. So many things with little difference, and the answer is changed. Same question is being asked. Remember, solve question wisely. Solve question nicely. Okay, or wisely. Sorry. Okay. So, a person presented with diarrhea, dementia, dermatitis, typical castle-like appearance, patient may have, yes, niacin deficiency. But if increased anthurionic, B6 deficiency. If deficiency of absorption of tryptophan or autosomal recessive heart nerve disease. If HIA increased, carcinoid syndrome. Hope you must have enjoyed the session. Yes, this is really, yes, I never thought. One more thing, blue diaper syndrome. Yes, this female is related to something blue. No need to mention. Yes, if tryptophan absorption is defective only in intestine. This was intestine and renal tubule, tryptophan and neutral amino acid. It is only tryptophan and intestine. Absorption is defective. Then blue diaper syndrome. Blue diaper syndrome. So I started this mnemonic with only baby doll, and ultimately this final thing was made. Okay, so you must have enjoyed this session. I have taken three lectures. I have planned 3 lectures for biochemistry. I know that time is limited, but I have some limitation because of my schedule. Yes, as I am a full-time faculty of biochemistry and psychiatry. Yes, I have gone through the phase of preparation of MD preparation 2 times in my life, and landed up once in my with biochemistry, and second time I landed up with psychiatry. Yes, at the age of 35 I did my MD psychiatry. Yes, and then yes, so but now I thought that I should explore other subjects also, as biochemistry my first love, and it is never forgotten. You all know, you are very well aware about that thing. So take care. Yes, the schedule is must be given, that is posted on our Telegram channel. So the complete schedule has been given. So take care, best of luck.